So last week we have started biomedical instrumentation part for 8 p.m. So which is one of the key subject, which plays a vital role in gaining marks and gaining some momentum towards your preparation also. Right? So these subjects are like core subject where we have come across lot of terminologies, lot of technical names when we go through. Right, so almost three years of biomedical field or 4 years of biomedical learning process. So it's nice to learn and it will be more interest. So compared to all other non-core subjects. So today's topic is all about biomedical instrumentation, which is today's topic is one of the very important topic where you can gain some momentum and where you can acquire entire mark from gate perspective, right? Right. So before that we shall warm up. So how many of you see this movie? How many of you have seen this movie? Can anyone name this movie? This one of the Hollywood movie. Anybody have seen this movie? Nobody? யாருமே பார்க்கலையா? Some answers?
No, sir.
No. Right. So this movie name was Whiplash. So Whiplash, 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 and it's a nice movie to watch. So if you have a free time, you can go and watch this movie. So your energy level will little bit, you can gain some energy from the movie, right? Okay, so forget about the movie. What this picture has given you some insight, not from this picture, what you can what you observe or what you interpret, something else. The biomedical engineers should interpret, right? Given some signal, if you given some image, you should interpret. Interpretation is a major key in our field. Okay, so by seeing this image, what interpretation you can do? Yes, I can go with Kavishri.
Sir.
It was long back ago, I have heard your voice, right? So it was a good time to hear your voice. What is your observation?
It's like a man shouting over the musician, sir.
Okay, what may be the reason?
Because he may done ஏதாவது தப்பா பாடிக்கலாம் சார்.
Can you relate with today's class? You know today's agenda, right?
Yes, sir.
Okay, can you relate with today's class?
The instrumentation relates to breathing, sir.
You're ரொம்ப technical போறீங்களே. Okay, somebody else wants to take challenge. So this is how Jaival's class is ordered. So he starts with this is the picture which I have taken from his notes, so his class notes. So it will be more interesting to start with. So it can be like a warm-up session. Only you can interact, or else so giving up these pictures will not. There is no use in giving these pictures. Danika, the voice is okay. Somebody wants to.
Sir.
Yes.
Sir, maybe மத்தவங்க எல்லாரும் சேம் டோன்ல வரும்போது இவங்களோட டோன் மட்டும் டிஃபர் ஆகும்போது ஆக்வர்டா இருக்கும்ல சார், லைக் டோட்டலா சேஞ்ச் ஆகும், அது இன்டரப்ட் ஆகுற மாதிரி இருக்கும்ல சார்.
ஓகே,
அத வந்து இசிஜியோட ரிலேட் பண்ணா லைக் பிக்யூஆர்எஸ்டி வேவ் ஃபார்மோட ரிலேட் பண்ணலாம்ல சார்.
சூப்பர். So fine. So the conclusion is like, so this picture is from Whiplash. So where the entire movie is all about musician and encouraging the music group without the basic uh, basic preparation, and finally he will succeed. So with lot of hard works, and this is all about the person who is shouting, right? So he's a musician, like he's a coacher, so he's music coacher. So he used to train some people. So we have some, yeah, we have a lot of orchestras in our villages and all. So in orchestras, so there will be different groups. So drums will go on. We have piano. We have, and there are a lot of groups, right? So அதுல ஏதாவது ஒன்னு sync, if there is one unsync happens, obviously the entire orchestra will not be in a good mood. So this is what happened here. So all other peoples are in sync. So only this person is in non-sync. So the same way your all your biosignals, if you take ECG, EEG, EMG, whatever it is, any biosignals, it is syncing and proper contraction, relaxation happens in heart. Obviously, you'll get a good normal PQRS waveform. If there was something fishy happened, or if there was some abnormality, or if there was something happened inside your heart due to some physiological changes, obviously your signal conditions also changes, right? So there is no need, like entire ECG signal will not change. So all PQ or yes, still yes, you will get a nice ECG waveform. Only in ST segment you can have more time taken to complete the ST segment, or there may be a increased amplitude in your QRS signal, or there may be a continuous abnormal QRS waveforms happens. So if there was one unsync signal happens in your ECG, obviously the doctors, so the doctors will identify, they'll interpret, yes, so here this is what happened. So this may lead to some they'll have linked with some clinical perspective, and accordingly they'll give diagnosis and they'll give therapy, right? So just to warm up, I have shown this picture, and today's class is all about ECG, EEG, EMG, EOG, and ECG. So quick abbreviation of each one of this. I'll go with anybody wants to take up Soumya T. Can you try this?
Yes, sir.
This class's strength is very less, only 22. What happened? Anything? Any agendas are there today from drives or something else? Only 22 of that. So kindly intimate in group to join the class. So somebody else. Yeah, Soumya, you can go through. What is ECG, EEG? Just abbreviate it. I don't need definition. I just abbreviate it. Hema.
ECG electroencephalogram.
Okay, yeah. ECG is EEG electroencephalogram, ECG electrocardiogram. Okay, EMG.
Electromyogram.
Electromyogram. What is EOG?
Electroacoulogram.
Electroacoulogram. Okay, what is EGG? We have one biosignal called EGG. We don't have that in by GATE syllabus, but it's nice to learn. ECG.
Electrogastrogram.
Electrogastrogram. And what is PCG?
Phonocardiogram.
Phonocardiogram. And each one of these signals we'll discuss. And one point I want to highlight before we start today's class, since it is crash course, each one of these topics will take at least 2.5 hours to explain. right? So theory part, block diagram, signals, how it acquired, what filters it can be preferred, and how it can be fetched and how it can be directed, and what processing it can be done, and what abnormalities, clinical trials, case studies. So there are a lot of hidden technical things in each topic. So we cannot cover all the topics, and this crash course, since it is crash course, I'll cover the ECG in detail. At least I'll take ECG and I'll discuss it in detail, and all other signals like you can discuss. We can discuss in gate perspective. So gate they will not ask you to write 3-4 pages of content in each topic. So they'll pinpoint and they'll ask you what it is, and it's nice to learn like very basic parameters. And Anna University syllabus, you will have a detailed coverage on each one of these topics in detail. Most probably in biomedical instrumentation, diagnostic and therapeutic equipments, and we have different subjects over there till your 8th semester. So you will study in detail. If you want in detail, right? So if you want the theoretical part in detail, you can ping me. If it is more than 5, we'll have a separate class on each one of these topics, right? So I'll cover ECG. If you want more knowledge to be learned, like it's the same Anna University pattern. If you don't understand your regular classes, or if you want some more else thing, you just ping me. So if it is more than 5, we'll have a separate class on that. Fine. So today's class is all about how gate preparation is going to happen and what type of questions we can expect from each one of these. But ECG I'll take at least one and I'll discuss in detail. Is that fine?
Sir.
Yes,
Sir.
sir.
Yes, thank you. And heart. So ECG is all about electrical events. So we're going to record and we're going to represent electrical event of heart. Okay, so heart is actually, naturally we are blessed with heart synchronization. So if there was any one small mismatch happens, or any small one unsynchronized pumping action takes place, or one action, we have studied action potential. If there was one cycle where depolarization and repolarization starts to degrade, so definitely your entire rhythm of your human organs, so not only heart. So if there was any problem occurs in heart, it affects most of the organs of a human system. You take any system, the nervous system, urinary system, you take neuro, you take digestive system, whatever it is, definitely it will affect. Why? Because there it gets where you can get a pressure of a blood. With a high pressure, it's going to supply blood to all other organs, right? So it's an very naturally we are blessed with having this much of synchronized heart, right? So yes, we're going to discuss about heart today, and we'll start with anatomy first. We'll start with anatomy of heart, and then we'll complete at least one system, circulatory system in anatomy and human physiology. So we don't have a separate segment for anatomy and human physiology. We believe when we understood that you know the basics. So anatomy and physiology, no one will train you. So only thing is you should have fundamentals. You should go through the fundamentals and you should study the anatomy and human physiology on your own. So yeah, heart, like how many chambers are there?
4.
So we have 4 chambers. What are they?
Right atrium, left atrium, right ventricle, and left ventricle, sir.
Okay. In that, which is upper chambers? So we have 4 chambers. Which is considered to be upper chamber?
Right atrium and left atrium, sir.
Okay, right atrium and left atrium. So atrium, it belongs to upper chamber, and lower chambers are right ventricles and left ventricles. Right? Okay. So comparing atrium and ventricle, which will be having more thickened walls. So where you will have a muscle, the thickness of muscle will be in which will have a more thickened muscle, whether atrium or ventricle.
Ventricle, sir.
Okay, so ventricle we have thick walls. In that, so right ventricle have a thicker wall, and left ventricle have a slightly thinner wall. But compared to atrium, generic ventricles will have a thicker wall. Okay. Okay. Why we are designed with? We are not designed. We are blessed with thicker wall. So if right ventricle muscles are getting thinner, what happens? So
So
you think
from
and
the
tell.
ventricle, from ventricle to pump, the blood has to pump out with pressure, sir. So the pressure would get low, sir, if it is
Okay.
thinner.
Okay. Why then left ventricle is thinner? Okay, just think and tell me why right ventricle alone is thicker and left ventricle is thinner, right? So if it is getting your muscle wall is getting thinner, obviously your ECG waveform will be in a different flow. Okay, fine. And if you take a blood flow path, just compare it with the blood flow path, you will get the answer. Okay. So
So maybe from the right ventricle it pumps to pulmonary trunk. It has to go to the lungs, sir. Maybe that's the reason, sir.
right ventricle, where it is going?
To the pulmonary trunk, to the pulmonary arteries, and then to the lungs, sir.
I think you are telling a answer vice versa. So that deals with left ventricle. Only the left ventricles, it pumps only the blood only to lungs. Right ventricle, it pumps throughout. It pumps throughout the body. Yeah. So we'll verify right here, and but we'll verify. Pumps blood throughout body. But here it pumps only to lungs. So that's why if it is thinner also you can pumping action will not disturb. As days goes on for aging peoples, there may be chances that right ventricles muscle will get thinner. So what happens during the ventricular contraction and ventricular relaxation, they'll get very quick ventricular contraction and relaxation happen because of thicker wall. And as days goes on, once your walls are getting weakened, so your entire heart pumping action will get damaged. So there will be leakage, a backflow of blood, all those things will happen. So thickness, it matters a lot. So ventricular thickness, fine. And the blood flow path, if you take from tissues and capillaries, it will reach atrium and then ventricle. So once first thing it will reach atrium, and after that it will come to ventricle. From capillaries and other areas. So this is ventricle. Okay, so we'll confirm that with a detailed anatomy. Yes, I think from left ventricle. Yeah, is that correct? Right ventricle, it's going to throughout the body, right?
Sir, correct, sir.
Okay, so right ventricle from right ventricle it is
Sir, but
going.
aorta தானே சார் கொரோனரி ஆர்டரியில போய் கொரோனரி
Sir,
ஆர்டரிஸ்
right
மூலமா பாடி
ventricle to
ஃபுல்லா
lungs, sir.
டிஸ்ட்ரிபியூட் பண்ணும். ரைட் வென்ட்ரிக்கல் பல்மனரி ஆர்டரினா பல்மனரி வந்து லங்ஸ் தானே சார் கனெக்ட் ஆகும்.
Here it is right ventricle. is going here. So a pulmonary artery is going to lungs. Right. Left ventricle, it is going to aorta, and it is. Okay, then I'll recheck and tell you. Okay, why? Yeah, someone find the answer at least. So why right ventricle is thicker? First, you find whether I'm right, whether right ventricle is thicker or left ventricle is thicker. Okay, so then find the answer. Okay, fine. We'll have a detailed anatomy. So where each is located, which is the entry point, which is the entry point for pure blood, which is the entry point for impure blood. Your heart, where pure blood enters, where impure blood enters.
Pulmonary veins get the oxygenated blood, sir, pure blood, sir.
Okay, so here this is blood entry. So all these things matters a lot when you appear for gate. So definitely you'll have some few questions where it is entering, where it is going. Immediately they'll give some sequence. So 1, 2, 3, 4. You just you want to highlight from where to where the pure blood is going, from where to where the impure blood is going. So all those details you should know. So there may be a question from heart especially. Okay, where is impure blood entry happens? Impure blood carried to heart by
Pulmonary veins, sir. First it enter into the right atrium, sir.
okay, like from impure blood from enters to right atrium through pulmonary veins or what? What about pulmonary veins carries. What about superior vena cava and inferior vena cava?
Superior and inferior vena cava carries the impure blood, sir, from.
That's what I'm asking. Impure blood entry into the heart. It is from superior vena cava and inferior vena cava. Yeah.
Yes, sir.
So this is the entry point for impure. Fine. So, and apart from that, about heart valves. So we have two heart valves, which is very important in pumping action, which is important in taking care of pumping action. So what are all those heart valves, which is where it is located? So we have two heart valves, right, between atrium and ventricle.
Yes, sir. Between right atrium and right ventricle, tricuspid valve, sir.
So here is tricuspid valve. Okay, so this is between right atrium and right ventricle. Okay, and here it is
Metal one.
mitral valve, otherwise called
Tricuspid valve.
yes. This is otherwise called tricuspid valve. Yeah, is that correct?
Bicuspid valve.
Sorry, bicuspid. So tricuspid is somewhere in there. So bicuspid valve, and this is between left atrium and left ventricle. Left is by 2 and right is tricuspid. Okay, just okay. What is the important function of heart valves?
It prevents the backflow of blood, sir.
Okay. If it plays the major role in opening and closing. So during contraction and relaxation, it will opens and close. So during contraction, it opens. During relaxation, if it doesn't close, obviously that due to the pressure in your right atrium, the blood will go at a reverse flow. So the backflow of blood will happen into a atrium. So instead of right atrium the blood on the left ventricle போறதுக்கு so there will be a reverse coupling happens. So the backflow of blood will go, and again it will affect all other physiological functions of your circulatory system. So very important function is to prevent a black flow into a atrium. Okay, so that is what we have heart valves. And apart from these two, we have another two heart valves, right? So what are they? One is that
Semilunar valve, sir.
okay, one is for aorta, and okay, another is for pulmonary artery. Okay, so all your pure blood, okay, all your pure blood will pump into aorta, and it will pass through all other parts of the body, and which is also what is the other name of aorta? Other name of aorta? Sorry, aortic valve, not aorta. Aortic valve. Where aortic valve is present? Yes, here. What is the other name of aortic valve? Semilunar valve. Okay, so aortic valve is present between left ventricle and aorta. So this is left ventricle, and this is red color is aorta. So in between that, you will have a aortic valve. Same way, pulmonary valve will located between right ventricle and pulmonary artery. So your purple is pulmonary artery, and your blue shade is right ventricle. So between these two, you will have pulmonary artery. Okay, so only when the pure blood is circulated, your aorta will open. So other than that, so your valve will get closed. The same way for this valve. Okay, so pulmonary valve. Okay, so this is all about heart valves, and coming to muscles. Okay, so heart muscles. So there may be one question in previous year gate question. We have different layers of muscles, right? So which is the outside layer of muscle in heart?
Pericardium layer, sir.
Okay, so outermost muscle is called as pericardium. Actually, this you cannot differentiate it, and if you see in ACD, there will be a slight deviation from your outermost layer and inner layer, and if you see in detail, or if you see in the zoom manner, you can see the difference. So outermost muscle layer is called as pericardium. So each and every small things, it will be more important in for your gate preparation. So especially in your heart, we may expect question because it's all about ECG and related with heart. There are different things. Okay, what is the inner layer of heart? Inner muscle layer.
Endocardium, sir.
So we have two layers. This is endocardium. Okay, so endocardium muscle. Okay, and what is myocardium muscle then?
The middle layers.
Middle layer. The muscle filled in inner part of heart actually. So all the muscles which is present in apart from endocardium and pericardium muscles, where all the inner heart muscles are called as myocardial muscle. Okay, all these muscles. Yes, myocardium. Okay, so we have two atrium which is present at upper chamber and two ventricles. Okay, fine. So we'll discuss how the blood flow happens. Before that, coming to artery and vein, which carries pure blood, which carries impure blood. And there are 2-3 questions. I want some answers. Today's class is only interaction class. I don't. This is not new to all of us. Definitely, you have studied a lot from your 10th standard, and ECG also you have studied. So, இதுக்கு முன்னாடி எடுத்த imaging at least okay third years தெரியாது. So, I have started with the detailed note. But ECG, EEG, I hope you have studied right now in third semester, and most of your colleges have completed unit 2. So, I want some interaction in today's class, or else it's matter of time to complete. I'll wind up class at very faster rate. I'll complete it very faster rate. You don't respond. Okay. So one question about R3. What is the function of R3? What is the function of vein? And which is the largest artery in our human circulatory system? Which is the largest vein in human circulatory system? And one more question is like, which there is only one vein which carries pure blood. What is that? So I have asked you 3 questions. I want some answers.
The pulmonary vein. Except pulmonary
Okay,
vein, all vein carries deoxygenated blood, sir.
Okay, who is that then? I can't able to see you.
The M. Priyadashini, sir.
M. Priyadashini, yes, very good Priyadashini. What is that? Which carries impure?
Except pulmonary vein, all the vein carries deoxygenated blood, sir.
Yes, pulmonary vein. Pulmonary vein is the only vein which carries pure blood. Yeah, pure
Yes,
blood.
sir.
Where it is arising from?
From the lungs to heart.
Okay, so it carries pure blood from lungs to heart. Very good. Okay, so one question was answered, and I have asked you what is vein and what is artery. Artery it carries pure blood. Vein it carries impure blood. Okay, which is the largest artery in a human circulatory system? Which is the largest vein in the human circulatory system?
Sir, aorta.
Okay, aorta is the largest artery. Okay, okay, largest vein.
Inferior vena cava, sir.
Only inferior or general vena cava? You can say both inferior and superior. Generic vena cava carries impure blood from to the heart from upper and lower extremities. Okay, so yeah, that's why it have more pure blood. Impure blood is carrying out, so it have largest vein in the human circulatory system. Okay, fine. Something else want to discuss here, and so where to where blood is flowing and all, you know. So aorta is the largest where which supply pure blood and carry blood away from heart to all parts of the body. Yeah, so aorta la irundha namak pure blood which is going, and this is blood vessel which have a smaller it again divides into artery divided into capillary. So capillaries are going till the end of each extremities. Okay, so pure blood is going on, right? Okay, and pulmonary vein, about pulmonary vein, it is it carries blood from the heart to lungs. Okay, sorry, the lungs to heart. Correct? Is that correct? Carries blood from lungs to heart. Yeah.
Yes, sir.
Towards
Oxygenated. Yes,
heart. Yeah. Over to blood.
yes, sir.
Towards heart, and after purification. Okay, and pulmonary veins and pulmonary artery. We have pulmonary artery. So in 2 in numbers. Pulmonary artery is different. Pulmonary vein is different. This is 2 in numbers. And important function of pulmonary artery is, what is the important functions of pulmonary artery?
It carries the
That
deoxygenated blood from the heart to the lungs, sir.
Okay. Impure blood from Heart to lungs, right?
Yes, sir.
Heart to lungs. Right. So these simple questions, you may get some questions from GATE. Okay, so it's nice to learn. And superior vena cava and inferior vena cava. Okay, we have superior, we have inferior. So superior vena cava carries blood from back top, right? So top of the body.
From body to heart.
Upper, up, yes, body to heart from. Actually, you can divide into two. So it is divided into one is upper extremities and lower extremities. So from upper extremities, all the impure blood are carrying from by superior vena cava, and lower extremities, inferior vena cava is carrying. Okay, it's carrying bottom half of the body, both bringing blood to right atrium. So this is the entry point. So your vena cava la nama impure blood on the heart la entry agra point. Okay, we have artery. So this red color arteries are again, if it is a big vessels from aorta, it again divided into small arteries, and from arteries we have arteriole, we have capillaries, and all those things. Okay, fine. About where the blood is carrying and flow path. If you want to insight a flow path, so can anyone give some flow where it is started, where it is going? First, we start with pure blood, or you start with impure blood, whatever you want. You can start with impure blood first, where it is impure blood is going. So this is your heart. Okay, you can take this. So this will be like figure. Okay, so where impure blood is coming, like first the impure blood is entry point is your superior and inferior vena cava. இங்க தான் நமக்கு first entry நடக்குது. Yeah. Immediately from inferior vena cava and superior vena cava, the impure blood will goes to right atrium. Heart la எப்பவுமே the first chamber which receives impure blood is right atrium. Right atrium, from right atrium your pumping action starts. Okay, so this will be helpful in your ECG signal analysis. So kindly keep in mind your P wave actually happens here. Okay, P wave. Okay, so your P wave happens here, and right atrium la da namak first blood vandu ulla varum. Okay, and from right atrium through a tricuspid valve, it passes to left. Blood passes here and it goes to ventricle. From ventricle it goes to through ventricle. It again, right ventricle contracts. When right ventricle contracts, this contraction happens, the blood ejected to pulmonary artery. Okay, we have pulmonary artery here. Okay, pulmonary artery, and the pulmonary. 1 minute, somebody came. Please be online, I'll be back. Okay, sorry, some interruption happens. So where we left? Okay, so from tricuspid valve, the blood passes to right ventricle, and from right ventricle it contracts, the blood ejected to pulmonary artery through pulmonary semiannular valve. Two valves will go for two lengths. So we have two valves for two lungs. It is going for lungs. So we have two lungs. So each one of the lungs will carry the semiannular valve. So again, it is deviated and semiannular. And finally, it reaches lungs. And the lungs, there will be a purification happens. And after purification, the blood, purified blood in the lungs, which carries O2. Okay, so it enters through pulmonary vein. So actually, this is not the entry point. This is the entry point. யாரும் சொல்லல, நான் சொல்றேன் அப்படியே ஓகேன்னு மண்டையாட்டிட்டு இருக்கேன். So this is exit for impure blood. So from pulmonary veins, your pure blood will carries from the lungs and it enters heart. Okay, where pure blood is entering, first thing is through left atrium. Always right atrium or left atrium, the entry will be there. Okay, so left atrium it enters, and from left atrium it goes through bicuspid valve here. So with contraction and relaxation, it opens and closes. So from bicuspid valve or mitral valve, it goes to aorta. It ejected during the contraction of left ventricle. This is left ventricle. During contraction, it ejected to aorta, and here we have aortic valve. So aortic valve. When aortic valve opens up, your blood will enter aorta to aortic valve. Again, it supplies aorta. It supplies to all other parts of the circulatory systematic circulation happens. Okay, so this is how the blood flow path happens. There may be a question like where to where blood is going, and there may be some questions like where impure blood is going, where pure blood is going, which valve is located between what two junctions. So all those questions, it is very important in heart. Okay, so this is flow path. Just for your identification, we have discussed and I have shown here. Okay, so from lungs, it is reddish pure blood. From body tissues, through vena cava, it is going to lungs. It is through impure. That fine? That's it about anatomy.
Yes, sir.
Okay. Any doubts? So இவ்வளோ hidden secrets தெரிஞ்சா போதும். ரொம்ப டீடைல்டா வந்து எனக்கு இன்டீரியரா வந்து ஒரு எம்பிபிஎஸ் டாக்டர் அளவுக்கு எனக்கு தெரியணும்னு இல்லை. இப்போ நம்ம என்ன டிஸ்கஸ் பண்ணுமோ that is more than enough to gate preparation. For gate preparation, and it is very mandatory that you should learn before you analyze ECG. You don't know what is ventricle, where blood is coming, where artery is located, where is atrium, and all. It's very tough to understand ECG signal. Okay, so once you know the blood flow path, you are familiarized with blood flow path. It's very easy to understand, and even interpretation you can do by using ECG. Okay, you can correlate. Okay, but QRS increase ஆக, அப்ப QRS na என்ன, atrium ventricle என்ன ஆகுது, அப்ப ventricle என்ன பிரச்சனை வரும். So all those interpretations you can do. We'll move on to phonocardiogram. So which is ECG phonocardiogram, and the definition of phonocardiogram is like it gives you what will be the output of phonocardiogram, whether signal, image, or sound, whatever. What will be the final output?
Sound, sir.
Okay, so
Sound
final
of the
output
heart,
of ECG is sound. It gives some murmur, or heart makes some murmurs. So small, like எப்படி நம்ம வந்து ஒரு blood pressure பார்க்கும்போது ஒரு கராக் sound இருக்கும், there will be a small critch ஒரு மாதிரி when you keep step that heart, you can listen the murmurs, heart murmurs. So those murmurs which is made by the heart are getting recorded by using phonocardiogram, and it will give you a plot also, the graphical part. In a GUI you can see the graphical part of heart murmurs. Okay, fine. And what is regurgitation? Whether have you come across this word before? Stenosis, regurgitation.
Yes, sir. Ventricle valves are any disorder at ventricle valves.
Okay, that is called as regurgitation. What is stenosis?
Disorder at upper atrium.
Both regurgitation and stenosis. So this is the abnormality happens in aortic, sorry, any valve. You can take valve abnormal. Okay, so we have discussed 4 valves, right? So heart valves. So in that, any abnormality happens. So obviously, either these 2 cases happens. One is regurgitation, stenosis. Okay, so regurgitation is nothing but blood leaking due to heart valves. Especially the heart valves doesn't close properly. When heart valves doesn't close properly, this is called regurgitation. Same case when heart valves doesn't open properly, it's called stenosis. So doesn't open, it is called stenosis. Doesn't close, it is called regurgitation. Okay, so this is opening, this is closing of any valve. You take mitral valve, tricuspid valve, aortic valve, whatever it is. If mitral valve doesn't close properly, obviously it is called as mitral regurgitation. If tricuspid valve doesn't open properly, that is called as tricuspid stenosis. Okay, so depends on what valve the doctors will identify that. Okay, so in the they'll have some on the sound which they can identify whether your heart have regurgitation or stenosis. Okay, okay, fine. You find what is regurgitation and stenosis. I'll tell you how to find with the given PCG signal. I'll show some PCG signal and I'll tell you where you have some regurgitation. Okay. Okay, then before that, you should know pathophysiology of heart, especially with related to PCG. Okay, so where each valve is located. Okay, so in your heart ribs, you have intracostal regions, and mid-clavicular regions. So each one of the intracostal region have its unique terminology where you have to highlight some valves. So the same terminologies you have discussed in ECG also. In your chest lead, you usually place the chest lead in intracostal regions where your heart valves are present. So then only you can have a ECG, nice ECG. Okay. So can anyone have some idea where from first right intracostal region which heart valve is present? First right intracostal region. Atrium. Okay, yeah, it's not atrium. Like each one of the intercostal region will or midclavicular region will have any one heart valve. Okay, first right intercostal region will have aortic valve. Aortic valve present in first right intercostal region. You can imagine like aorta எப்பவுமே ஒரு ஹார்ட்டோட அப்பர் சேம்பர் மேல தான் இருக்கும் இல்லையா? அப்போ நம்மளோட ரிப் கேஜ்ல ஃபர்ஸ்ட் ரைட் அப்படின்றது யூ கேன் டச் யுவர் ஹார்ட் லைக் ரைட் சைட்ல மேல வந்து உன்னோட ரிப் கேஜ்ல ஃபர்ஸ்ட் போன் இருக்கும் இல்லையா? அதுதான் ரைட் இன்டர்காஸ்டல் ரீஜன். ஓகே, ஸோ ஆப்வியஸ்லி தி அயோட்டா உன்னோட ஹார்ட் இமேஜின் பண்ணிக்கோ, அதுக்கு மேலதான் அயோட்டா இருக்கும். ஸோ ஈஸிலி யூ கேன் ஐடென்டிஃபை ஃபர்ஸ்ட் இன்டர்காஸ்டல் ரீஜன் ரைட்ல யூ வில் ஹேவ் அயோட்டிக் வால்வ். அப்படியே நீங்க வந்து ஹார்ட் கொஞ்சம் கீழே வந்தீங்கன்னா இமீடியட்லி ஆஃப்டர் அயோட்டா in the left side you have pulmonary valve. Left mid-clavicular region. Your right side I have aortic valve above your heart chambers, and your left mid-clavicular region you will have a pulmonary valve. So from the pulmonary valve only you can send blood to the lungs and all. So pulmonary valve which is present in the left mid-clavicular region. Okay, fourth mid-clavicular region you have tricuspid valve. And fifth intercostal region, only one valve left, which is bicuspid or mitral valve. So this is very important in identifying abnormalities, especially in PCG sound murmurs. Okay, is that fine? Is that fine? Any doubts? First, you just try to recall. If they give left mid-clavicular region, you should say it is pulmonary valve. It is fifth right intercostal region, you should say mitral valve. Okay, accordingly, you can diagnose whether it is regurgitation or stenosis happens in which valve you should know. Yeah. So I'll show some PCG
Sir?
signal in yes.
Sir, doubt, sir. Sir, right side of the chamber la thana sir tricuspid valve irukum. So left la tricuspid valve, mid clavicular region na differ aguma, sir?
Rib gauge வந்து பாத்தீங்கன்னா it will differ. Okay, mid clavicular region நம்ம அப்படியே நம்ம டைரக்டா ஹார்ட் நம்மளோட பாடி ரெண்டா பிரிச்சு வைக்க மாட்டோம். So obviously the mid clavicular region will located at some like below your heart chambers. So at your below your shoulders and heart chambers. So it is entirely different from, you cannot direct okay left and right னு பிரிக்க முடியாது. Some rib cages பின்னாடி அந்த ஹார்ட் இருக்கிறதுனால லைக் ஒரு சென்டர் ஆஃப் rib cageல இருக்கும். அப்ப ரெண்டு சைடுமே உங்களுக்கு அந்த ஹார்ட் வால்வ்ஸ் வந்து உங்களுக்கு டுவர்ட்ஸ் அந்த ஹார்ட் வால்வ்ஸ்ல தான் உங்களுக்கு அந்த சவுண்ட் வந்து நம்மளுக்கு கேட்கும். சரியா? ஸோ அதனாலதான் வந்து லெஃப்ட் ரைட் அந்த சேம்பர்ஸும் clavicular regionsum different. If I have some slides in upcoming slides, I will show you where mid clavicular region is located.
Yes, sir. Yes.
Okay.
Thank you,
Right.
sir.
Okay. So ipo namakku you should be able to recall if they give some questions in 2020 biomedical. We have one question from this part. First you should know what is regurgitation and what is stenosis. Where regurgitation occurs, where stenosis occurs. அது கண்டுபிடிச்சிட்டீங்கன்னா அதுக்கப்புறம் ஃபர்ஸ்ட் இன்டர்காஸ்டல் ரீஜன்ல அக்கர் ஆச்சுன்னா அது அயோட்டா. If it is first, there are two different segment in your question. One is, I'll show you a phonocardiogram. Yes. Phonocardiogram, this is your PCG signal. Okay, so you have some murmurs, right? So this is the graphical view of heart murmur sound. So sound signal was given here. Between first and second heart sound, this is first heart sound, this is second heart sound. Between first and second heart sound, okay, if there was any abnormality in your phonocardiogram, so that will be identified in the PCG. So first and second heart sound க்கு நடுவுல இருக்கிற abnormality we usually called as regurgitation. Between 1 and 2, first and second heart murmurs of PCG அப்படின்னு கொஸ்டின்ல இருந்துச்சுன்னா regurgitation அப்படின்ற first segment of your question நீங்க ஐடென்டிஃபை பண்ணுங்க. Second segment of questionல என்ன சொல்லிருப்போம்னா, what will be the final abnormality in a first right intercostal region between first and second heart murmurs கொடுத்திருப்போம். அப்போ first and second அப்படின்னா regurgitation, first intercostal region aorta. அப்போ you should come to conclusion that aortic regurgitation. புரியுதா? For example, fifth intercostal regionல second and third அப்படின்னு கொடுத்திருந்தோம் அப்படின்னா, if there was any abnormality happens between second and third murmur of your heart, so that is called as stenosis. And 2 நடுவுல இருந்துச்சுன்னா that is regurgitation. 2 and 3, in between 2 and 3 it is called as stenosis. இப்போ உன்னோட question வந்து what is the abnormality? They'll give you 4 options: atrial regurgitation, aortic regurgitation, mitral stenosis and all. Okay, mitral stenosis and all. You have to pick any one. The question is, if there was some abnormality between second and third heart murmurs in fifth intercostal, fifth left mid clavicular space, அப்படின்னு ஒரு question இருக்கும். What will be the answer? first one is second and third அப்படினாலே you should come to conclusion it is stenosis. Okay, remaining two options you can eliminate. 2 and 3 it is stenosis. 1 and 2 this is regurgitation. அதுக்கப்புறம் you just identify fifth intercostal, fifth left mid clavicular space அப்படினா it is mitral valve. Oh, it denotes mitral valve. அப்போ your answer will be mitral stenosis. புரியுதா? இப்போ இந்த ரெண்டு ஸ்லைடு வந்து உங்களுக்கு தெரிஞ்சிருக்கணும். ரெண்டுல is where aortic valve located, where pulmonary valve located, tricuspid, mitral. இது தெரிஞ்சிருச்சு அப்படின்னா you can identify which valve it is. Okay, and to differentiate regurgitation and stenosis between first and second heart sound abnormality, it is called as regurgitation. Between second and third sound heart abnormality, it is called as stenosis. So you can differentiate stenosis and regurgitation easily. Clear?
Yes, sir.
There is
Clear.
one question from GATE 2020, and you may have questions from this in your mock test also, in your mock BME. You just have some fun while answering some questions here. So different combinations they'll ask you, so you should be able to answer. And always ECG one more information left was during systole. Okay, systole நடக்கக்கூடிய உன்னோட ஹார்ட்ல systole. What is systolic? What is diastolic? What is systolic pressure? What is diastolic pressure?
Contraction and relaxation pressure, sir.
Okay, systolic is for contraction, right?
Yes, sir.
Okay, when heart contract, it happens in systolic. So during that time you will have a first murmur. Okay, contraction நடக்கும்போது first murmur வரும். அப்போ வந்து உன்னோட ஹார்ட்ல மர்மர் இருந்துகிட்டே இருக்குமா அப்படின்னா பிசிஜில கண்டிப்பா இல்ல. ஒன்ஸ் அந்த உன்னோட கண்ட்ராக்ஷன் ஸ்டார்ட் ஆகும்போது you will have some murmur sound in your heart. So there will be some stretch sound in your heart, and then there will be a flat line. Okay, so till it reaches contraction, when it relax, அது வரைக்கும் உங்களுக்கு flat line தான் இருக்கும் பிசிஜில. When contraction happens, which is diastolic, during contraction of heart muscles, there will be a second heart murmurs happens. Okay, and after the heart ejected, blood ejected from each one of the cardiac cycle, you will have a slight murmur. So in your stethoscope and all you cannot hear, but when you record it as a signal, you can have a slight murmur in your third heart murmur signal. So it is, we have three signals, heart murmur signals for a one contraction relaxation. For one pump, ஒரு தடவை heart pump ஆச்சுன்னா you will have three murmurs, heart murmur signal. It will be recorded in a graph which is called as phonocardiograph, right? And apart from phonocardiogram, we have other graphical signals are there. Like this is ECG. Okay, it is nice to learn ECG and ventricular volumes. We have stroke volume. We have cardiac output. Okay, how to relate cardiac output with stroke volume? If you find stroke volume, how to relate cardiac output?
Stroke volume into
Heart rate, sir.
heart rate. Okay, so if you have stroke volume and if you have heart rate, just multiply, you will find stroke volume. So what is the normal value of stroke volume, cardiac output, heart rate? Heart rate is 72. Okay, even my daughter says yesterday we had we and ma'am had an interaction. So just analyzing our interaction, yesterday he said heart rate is 72 beats per minute, even a kid, right? So heart rate is 72 beats per minute. What is stroke volume? Normal stroke volume?
It's a 5 to 6 liter. Sir.
No. Cardiac output is 5 to 6 liters, right? Stroke volume?
60.
60 60 ml, right? So 60 to 70 ml is ml. So cardiac output is 5.5 liters per minute. Okay, so this is normal value. And we have aortic pressure, we have ventricular pressure, okay, we have systole, we have diastole, okay, pressure in mmHg, all those. So where you have pressure. So this diagram is called as, can anyone give what is this diagram called as? It's a very important diagram in biomedical instrumentation. What is it? Okay, while you're coming for next class, you should say. So in the diagram or a name and yeah. Okay. So
Yes.
each one of the waveforms will be related with your heart pumping action. Okay, we start with PCG, same way ECG. எப்போ வந்து உன்னோட heart volume, blood volume decrease ஆகுது, எப்போ increase ஆகுது. Okay, so during systole it decreases, during diastole, contraction, relaxation, it increases, again it decreases. The same way you take pressure. Okay, your pressure will keeps increasing during ejection, during systole, diastole, how it is, and even during valve closure, valve opens. Okay, how the pressure increases, pressure drops, and so there may be the question paper setters, they'll attempt to take some questions from this. Okay, they'll say like aortic valve closes. Okay, what will be the like pressure, aortic pressure in the heart, whether it increases, decreases, remains same, or whether negative, like that. So there may be questions from simply you just understand the diagrams here. Okay, so from these diagrams, these waveforms, you can answer any of the question. Okay, fine. Coming to ECG again, so almost we have 1 hour we have spent with general concept. Now we come to ECG. Okay, so this is the ECG waveform PQRST, and quick representation of each waveform. What is P wave? Where P wave occurs? Occurrence. I want some occurrence of each waveform. Where P wave occurs? படிச்சிட்டீங்களா? எல்லாம் பிஎம்ஐ படிச்சாச்சு, எனக்கு தெரியும். தேர்ட் இயரும் படிச்சிட்டீங்க, ஃபைனல் இயரும் படிச்சிட்டீங்க. ஜஸ்ட் நவ் தேர்ட் இயர் படிச்சிருக்கீங்க. P wave எப்போ அக்கர் ஆகும், QRS எப்போ அக்கர் ஆகும், P wave அக்கர் ஆகும் எப்போ? First heart enters, heartல blood enters at which chamber?
Atrium.
Right atrium, sir.
Okay, generally atrium. Okay, atrium. Right atrium, இந்த சைடு வந்து left atriumல வந்து like pure blood, இங்க impure blood, right atrium. Okay, atrium, blood enters. Always your ECG occurrence, your ECG waveform starts with atrium. Why? Because where the blood enters. Okay, atrium. Okay, you relate with action potential. We have studied action potential last class. It's very easy, right? So இது வந்து recall பண்றது ரொம்ப easy, shortcuts இருக்கு.
Depolarization, sir.
Yes. First வந்து P wave ல இருந்து ஆரம்பிங்க. இது ஞாபகம் வச்சுக்கிறது எப்படின்னா, in our heart blood enters first in which chamber? It is atrium, obviously. So P wave related to atrial. Okay, இதுக்கப்புறம் என்ன வரும் அப்படின்னா, we have studied action potential curve. Okay, so we have studied action potential curve. Yeah, so this is depolarization, this is repolarization, this is absolute refractivity. Okay, so in action potential, first occurrence will be depolarization. Appo P wave is first blood flows towards atrium, inga depolarization, combined together atrial depolarization. Okay, so this is the occurrence. of each heart cycle, P wave. Okay, fine. Next is QRS. We don't have occurrence for specifically for Q, specifically for R and S. The combination of QRS will have some occurrence. What is QRS? Where blood goes after atrium.
Ventricular depolarization, sir.
Okay. After atrium, I'll tell you. Okay, if you'll have one question. Okay, we have depolarization, sir. So obviously, action potential repolarization வரணும்ல. நீங்க ஏன் repolarization எழுதாம டைரக்டா go for ventricle அப்படின்னு கேட்கலாம். Again, the same question I'll post with you guys. You find the answer. Okay. So 1 minute, some guests have come. 1 minute. I'll join. 10 minutes. Okay, sorry, like QRS is again atrial depolarization occurs after atrium. The blood will flows through ventricle, right? So here you will have ventricular. Obviously repolarization முடிஞ்சிருச்சு. அடுத்தது ventricularல obviously depolarization நடக்கணும். So we have ventricular depolarization. Fine. இப்போ again we have T wave, yeah. So PQRST முடிஞ்சிச்சு. We have T wave. So what is T?
Ventricular repolarization.
Okay, ventricular repolarization. இப்போ அந்த flow வருதா, you combine action potential with flow and the blood flow. So then it's very easy to recall the occurrence where T wave occurs, QRS, T wave occurs. So atrial depolarization, ventricular depolarization, ventricular repolarization. Okay, okay, fine. Then where atrial repolarization occurs, we don't have signals for atrial repolarization, right? அப்போ அது நடக்காதா இல்ல வந்து அதுக்கு சிக்னல் எங்க இருக்கு அந்த சிக்னல் atrial depolarization?
Sir, actually it occurs in QRS complex, sir. Due to the low amplitude, it's not visible, sir.
Exactly. So atrial depolarization occurs at P wave, and we have some flat line, and it takes some time, and after that repolarization or ventricular depolarization will starts at same time. Okay, the both enters in your blood வந்து atrial ல இருந்து ventricle வந்தோனே immediately it will starts your muscle, heart muscle will starts to it reaches the maximum peak 35 millivolt reach ஆனோனே again it starts to repolarize. Your atrial muscle starts to repolarize, at the same time ventricular muscle starts to depolarize. அப்போ it hiding in your QRS. Okay, so atrial repolarization hiding in the QRS complex. Fine. So this is how the occurrence is, and we have QT segment. So we have QT interval or QT segment. So in QT segment, you can have total deviation. Of ventricular repolarization. Okay, so till Q to T, if you can find total repolarization of ventricular time. Okay, now I have a question. Why these waveforms are differ in amplitude? So P wave we have only, so this is amplitude and this is time period, right? So QRS if we measure panna, this is time period and this is amplitude. If you take P wave compared with QRS, why amplitude of P wave is small compared to QRS? Just find answer comparing your anatomical study and your occurrence and tell me the answer. It is very simple. We have studied and I have given you some hint at start of heart anatomy.
Sir, because ventricle will supply blood to all the parts of the body, so lot of pressure will be there, no sir. So the amplitude was high at QRS.
Okay. Yes, Priyadarshini, you are little bit closer. Okay. Exactly. Your answer is direct, but one more point. I'll be expecting one more point. Okay, it is carrying. It supplies blood to all parts of the body. So what happens to ventricles? Ventricle. What happens to ventricle? Thickness of ventricle. Particularly thickness. You have ventricle and atrium. So which is thickened, which have thickened heart muscle? Ventricles. Yeah. Okay. So thickness of ventricle is high, so you get more amplitude. So QRS is nothing but ventricular depolarization and repolarization. So that's why you get more amplitude. ECG. Okay. The same way you take atrium, we have only minute amplitude in P wave because atrium will depolarize and repolarize at very shorter pulse because the thinned wall, it have a thin heart muscle. So the depolarization happens at a very faster rate. Okay. So and as Meenakshi told, the waveform, it have repolarization also. So inge mudinjirukum. So but அதோட வந்து உன்னோட ventricular depolarization peak is high, so we don't it is a hidden signal over there, so it is hidden inside QRS. Fine, clear your QRS and the clinical analysis. When there was some QRS time period increases, what happens? P wave amplitude increases, what happens? QRS amplitude decreases, what happens? If ST segments prolong, what happens? If there was some inverted PR like this, what happens? Okay, all those clinical interpretation you should know. So giving some ECG, they'll ask you like in gait what abnormality you may have. So that type of deeper questions also expected at gait level, right? So this is what paper it is. This is ECG thermal paper. By using this, you can you can calculate amplitude and time period of ECG signal. Okay, so very simple. You have boxes, right? So you can minutely see you have one complete box is this. So I have highlighted here. So each one big square. So this is big square. One big square contains 5 small squares, either in horizontal or vertical. So this is big square. If you say this is 1, 2, 3, 4, 5, right? Can you follow me? You can have 5 small squares combined together. You have one big box. Clear? In a standard, this is standard ECG paper. In the university, it is standard ECG, right? So 5 big boxes will have a 5 small boxes will have one big covering, right? Can you follow me?
Yes, sir.
Okay. If you analyze ECG in x-axis, if you analyze ECG in y-axis, what did you analyze in y-axis? Sorry, this is y-axis, right? This is. What analysis can be done in x-axis? So this is called amplitude, right? So this is y. X-axis, you identify this is time duration. What is your amplitude? All those things you can identify. Okay, all your amplitude and time period. 5 big boxes will have 5 small boxes will have one big box. Okay, so universally each small box, okay, each small box will be in terms of horizontally, in terms of x-axis, it is time division. So each small box will have 40 milliseconds. Each small box. Okay. Upon total, how many milliseconds you have for one big box? For one small box, 40 milliseconds. Okay. But total time period for one big box,
0.2 milliseconds.
0.2 milliseconds or seconds? How many milliseconds are there? Just
Seconds.
multiply. Yeah, just multiply it 5. So 5 small boxes, 40 milliseconds. It is 200 milliseconds, or as Bhaskar said, 0.2 seconds. We can have either one of these two, 200 milliseconds or 0.2 milliseconds. The same way, amplitude, you have 5 small boxes together, you will have a one big box. So one small box will have 0.1 millivolt. Here it is denoted by millivolt. This is milliseconds. So totally on the full box you have 0.5 millivolt. So this will be very helpful for you to calculate heart rate from given any ECG. You have done some laboratory instruments in your laboratory, right? So BMI laboratory, you have some signals in DSO. So DSO, after connecting ECG, you will have some signals. So if you go into the DSO, you have small boxes, big boxes, and all. So you can calculate heart rate by having 2 RR interval and all. So this calculations is very important. In gate also, they'll give some ECG signal and they'll ask you to find what heart rate it is. Okay, so this is one of such questions. This is gate question, instrumentation. Even instrumentation, they ask you to find heart rate by given ECG signal. So can anyone give some values here? What is the heart rate? Calculate heart rate. $30 seconds. Very easy. 30 seconds. Okay, first tell me how many, what is the time period? Where you should calculate time period to where? Yes. Where to where you have. Okay. Where to calculate? This is R to R. So this is P, Q, R, S, T. Okay, the same way here. So this entire duration you should take. Okay, take and calculate time period. What is the time period between this R to this R? Covers
0.4 seconds.
Right? Okay, 0.4 seconds or can say 400 milliseconds. So this is 200, this is 200. How 200? Each one of the cycle have like 40 milliseconds. So 5 into 40 or 200, and here 5 into 40, 200. So totally you have 400 milliseconds. Am I clear? இது வரைக்கும் எது டவுட் இருக்கா? எப்படி 400 வந்துச்சுன்னு? ஏன்னா இது ஒன் ஆஃப் தி மோஸ்ட் இம்பார்ட்டன்ட். இசிஜில இருந்து பெருசா கேட்கறதுக்குலாம் ஒண்ணும் இல்லை. மூணே மூணு கான்செப்ட் தான். அதுல இருந்து தான் கேட் கொஸ்டின் வரும். அதுல முக்கியமான கான்செப்ட் இது. எது டவுட் இருக்கா? 400 milliseconds எப்படி வந்துச்சுன்ட்டு?
No, sir.
Okay. How to convert this into minute? So heart rate, you say 72 beats per minute, right? So just divide it with 60. So this one heart beats for, see, இங்க இருந்து இது வரைக்கும் ஒரு heart beat. அப்போ one beat, it takes 400 milliseconds. How many such heartbeats will take for 1 minute? அப்படின்றத calculate பண்ணணும். அப்போ 1 minute we have 60 seconds divided by 400 milliseconds. Okay, and just find it answer like 0.15 வரும். And if you want to calculate it into minute, it is in milliseconds. You just convert it into minute into 10 to the power of 3. You will have 150 beats per minute. So this 60 is to convert into minute. Just divide 60 by the given find milliseconds. You will find the final answer. Any doubts here? So this is very easy ECG waveform. They may give you like, so inga irundhu kuda kodupanga. So inga irundhu or R wave. So intermediate small boxes if they give, you just calculate small boxes. Each small boxes have 40 milliseconds, and you multiply how many small boxes it have, and then you divide it by 60. Just divide it by 60, you will find answer. There may be an NAT also, so numerical questions. If they put 0.5 as your answer, it is wrong. You have to give it in minute, right? So you just multiply it is in milliseconds. It is in minute, so just multiply it with powers 10 to the power of 3 milliseconds. Yes. Purinjicha? Okay. We have one more question left here. Yes. So, quick answer for this question. ECG with 10 RR waves. So this PPT have only one RR wave. It have 10 RR wave. Sir, can you unmute? Okay, it have 10 RR waves and it occurs in 6.7 seconds. Okay. Yeah,
கௌசி போன் பண்ணுச்சுமா
Kaveshri. Okay, thanks. Okay, for 10 RR wave, it was 6.7 seconds. Okay, calculate heart rate. Between two peaks. Yeah. What is the answer?
67, sir.
67. Okay, yeah, you have 6.7 seconds. You just convert it into 1 minute. 60 by 6.7, you'll get answer. Yeah, I'll have some. There was some small thing. Okay, between two peaks.
89, sir.
80.
89, sir.
89. Again, you have to recheck your answer. Yeah, you just multiply with 9 bits. Yeah, 1 minute. I'll tell you some small hidden things here. Okay, between two peaks, how many beat you will get? Between two peaks, how many beats, heartbeats you will get? So this is two peaks, right? So 1 hour to 1 hour. ரெண்டு பீக் நடுவுல எத்தனை ஹார்ட் பீட் உனக்கு கிடைக்கும்? How many heartbeats you will receive between two peaks? பதில் சொல்லியா? இப்படிலாம் இருந்தீங்கன்னா கஷ்டம். Am I audible?
Yes, sir.
Hello.
Sir.
Can you understand my question? இல்லைன்னா கேளு, நான் சொல்றேன். இப்படியே சைலண்டா இருந்தா என்ன பண்றது? Very tough for me to carry the class forward. One R waveக்கும் இன்னொரு R waveக்கும் நடுவுல எத்தனை பீட்ஸ் இருக்கு? ஹார்ட் பீட்ஸ் எத்தனை? ஒரு ஹார்ட் பீட் வரதுக்கு எத்தனை சைக்கிள் தேவைன்னு கேட்கறாங்க. எத்தனை RR இன்டர்வல் தேவை? How many cycles are there? For one beat?
One beat.
Yeah, for two peaks, right? So between two peaks, we obtain one beat. Clear? Okay. Between 10 peaks, they given 10 peaks. How many beats will be there?
5.
5 or every 5? It is a cumulative one, right? So அடுத்த beat வரும்போது you can have one beat for two peaks. மறுபடியும் இந்த பீக்ல இருந்து அந்த பீட் வரைக்கும் வரும்போது உனக்கு 10 peaks you have 9 beats. அப்போ ஒரு டைம் இன்டர்வல் அவன் என்ன கொடுத்திருக்கான்னா 1 beat it's 6.7 seconds. Okay, so you just again divide it by 60. You will have what will be the value? Someone calculate and tell me what is the value here. So this is for இதுக்கு முன்னாடி பண்ண மாதிரி தான். For 1 beat it is 6.7.
0.402.
0.40. You just have I have some different.
Sorry, sir.
Check.
8.9.
8.9.
8.9. Okay, this many seconds you require for 1 minute. Okay, you have 9 beats. Just multiply with 9. Okay, you get around approximately 80 beats. Your answer. Any doubt?
No, sir.
No, sir. No doubt, sir.
Thank you. So, shall we proceed with? Yeah. Hereafter, it's a quick review. You're going to give some answers. What is the answer for this ground electrode while recording standard 12-lead system? What is the answer?
Right leg, sir.
Okay, right leg. Fine. In a standard 12-lead ECG system, the minimum number of electrodes required to attach a human subject for recording one unipolar chest lead signal is dash. What is the answer? ஒரு chest lead, unipolar chest lead எடுக்கிறதுக்கு how many electrodes are required? So this is one question. I'll post you another question. For 12-lead ECG, how many electrodes are required? How many? For
10.
recording 12-lead ECG.
electrodes, sir.
Okay. This is 10. Where 10 electrodes are placed? Quick review: left arm, right arm, left leg, right leg. Apron. This is 4. 6 is for chest.
Chest electrodes.
Okay. Okay. So this is 10. Okay. Here, what will be the answer? For one unipolar chest lead. What is unipolar chest lead? எங்கெங்கெல்லாம் electrodes place பண்ணுவீங்க unipolar chest lead?
AVR, AVL, AVF, அதுவா sir? Right arm, left foot.
No, this is they have given chest lead. Only by help of chest lead you cannot take signal. So you have to place in all left arm, left leg, right leg, and one lead instead of 6. Since it is unipolar, you can place 1. How many electrodes are required then?
5.
5. புரியுதா? Unipolar general chest lead கேட்டாங்கன்னா all 6 will come. Unipolar chest lead அப்படின்னா obviously only with the help of chest lead we cannot measure ECG. For that you require right arm, left leg, right leg signal. And since it is unipolar, only one chest lead electrode will be connected. So totally it will be 5. So we're going to discuss in detail about ECG. Before that, how many electrodes are recording? Okay, this is 10, right? Yeah. What will be the answer for this one? Can anyone try this one? Or whether this concept is new, or can anyone know the answer for this? Or else we'll discuss ECG and then we'll come back. Quick response. Already time ஆச்சு 9-10 வரைக்கும் உட்கார்ந்தே இருக்க போறியா இல்ல will wind up? ECG தெரியும் இதெல்லாம் படிச்சிருப்பார்.
Sum of the two electrodes is equal to third lead, sir.
Sum of two electrodes is equal to third electrode. Okay. Can you give some expression? As an expression, how to calculate this?
B2 equal to V1 plus V3.
1 plus lead. If you know
Sir,
the,
maybe the option C is the answer.
yeah, just find the answer. If you add these two, you should have lead 2. 2.1 plus 1.6, you'll have 3.7, right?
Yeah,
Okay.
yes, sir.
The same way here, 3 plus 1.2, it is 4.2. So obviously this is not right. So here 1.8 plus 4.7, again it is going 5. So it is 2.9. So this is not correct. And here you have 3.2 plus 0.9. You have 4 point something else. So you don't have 2 point. So obviously option C is the right answer. There are a lot of questions may be expected from, especially in this concept. Okay, it's nice to learn. So if you know lead 1 and lead 2 biopotential, you can find lead 2. 1 and 3 will make lead 2. Lead 3. If they ask you lead 3, how will you write? Lead 2 minus lead 1. You can subtract, you can bring this side, you can bring that side, and you can find answer. If it is lead 1, you can subtract lead 2 minus lead 3, like that. Okay. Okay, coming to leads, ECG leads, you have universally you have 12 lead system, and that 12 leads are placed, 3 limb leads, 3 augmented leads, and 6 pericardial leads. So totally you have 12 leads. So lead is different from electrodes. So we'll discuss what is limb leads. Okay. ECG color coding, again there may be a question from color coding. So which color is for universally they'll follow the color coding, and for the people those who new to ECG, you can place 4 electrodes in limbs. Okay, right arm. Okay, so right arm, left arm. Okay, right leg and left leg. So right leg is ground. Okay, four regions you will place. Okay, right leg, right arm, left arm, right leg and left leg. So right arm is for white, left arm is for black. Okay, you should keep in mind, right arm is for white, left arm is for black. Right leg always ground will be green here. So நிறைய பேர் என்ன பண்ணுவேன், எப்பவுமே நம்ம லேப்ல எல்லாம் சர்க்யூட்ஸ் லேப்ல we have black as a ground. So இங்க வந்து நீங்க ground black னு கொடுத்தோனே immediately will match with right leg. It is not like that. Right leg is for green, left leg is for red. Okay, so right leg white, black, green and red. So wherever you go, if you find some if we find some chance to visit ECG signals and all, just see the color coding. That may be a question from this part also. And what is the color of chest electrodes?
Brown.
Brown, right? So this is brown. Okay, and so this is where we place like chest electrodes. So coming to anatomy, first drip, this is second drip, third drip, fourth drip, fifth, sixth, 7, 8, 9, 10, like that. So slightly the heart is located, it's not at center, slightly like it will go beyond center place, and right side also you will have some heart signals. So this is where you can place your electrodes. Okay, so all the chest electrodes are unipolar electrodes, and all the leads where you connect chest electrodes are called as pericardial leads. So it is very important to know the part like what is pericardial lead. So pericardial lead is for chest. So yeah, so okay, what is unipolar and what is bipolar? Quick reference, what is unipolar? Quick சொல்லணும், தெரியும் உங்களுக்கு எல்லாரும் படிச்சிருப்பாங்க.
So voltage difference between active to the reference electrode, we call it as unipolar, sir.
Okay, so simply one measuring electrode plus one reference. Okay, in bipolar,
Two active electrodes. Yes.
Measuring electrode plus one reference. You have reference for bipolar also. Okay, but two measuring electrodes. Fine. Okay, so this is where the placement of leads are there. So V1 fourth intercostal region of right sternum, V2 fourth intercostal region of left sternum, V3 halfway between V2 and V4. V4 is fifth intercostal region of mid clavicular line, and V5 is left axillary line, same horizontal plane to V4. So V4 is straight or horizontal line, you can have V5. V6 is between V4 and V5. Okay, so horizontal plane between V4 and V5. And right arm denotes RA denotes right arm, inner wrist. So you should place inner side, so not at the extra side, and right leg and left side, left leg. So it's lead placements. Coming to Einthoven triangle. So can anyone give some explanation on Einthoven? So Einthoven, who invented ECG, and lead 1 is for what? Lead 1 is equal to, so this is what? Right arm. Yeah, this is left arm, this is left leg. Okay, so this is white color, black and red color. And what is lead 1? It is between what to what? How to calculate lead voltage, lead current? This is between left arm minus right arm. சொல்ல மாட்டேங்கிறீங்க. Lead 2
Left leg minus right arm.
have one sign at least. So it's very easy. Right arm is minus and minus, left leg is plus plus. Opposite signs you can put for left arm, plus minus. Okay, accordingly you can write down this expression. This is very easy. So plus முன்னாடி எழுதிட்டு minus பின்னாடி எழுது. Lead 3 is left leg minus left arm. There may be a question from this also. So they'll give voltage for left arm, right arm. They'll ask you to find the lead one. And they'll, இப்போ இதுக்கு முன்னாடி பார்த்த மாதிரி 4 எக்ஸாம்பிள் கொடுத்துட்டு அதுல எது கரெக்ட்னு கூட கேட்கும். If you don't know this expression, you cannot identify. So why Einthoven triangle is located and where it is a central point of heart, right? So it is a center vector. If you take vector heart sinoatrial SA node, all your right arm, left leg will, if you take the if you draw the line, it's located at the center of SA node. Okay, so that's why it is Einthoven identify this ECG waveform. You will have a nice ECG waveform. You place electrodes and record biopotentials. Okay. Okay, fine. This slide is like okay. Name the leads in top and bottom. So this is top, this bottom. Okay. So name the leads. So top is for which lead and bottom is for which lead?
Sir, in the top it is bipolar, in the bottom it is unipolar, sir.
Very good. Bipolar. Okay, so this bipolar leads and this is unipolar. What is the other name of bipolar? What is the other name of unipolar? Otherwise, unipolar leads is called as what? So either
Augmented, sir. Augmented limb leads, sir.
This is augmented. What is the other name of bipolar? Where it is placed, your electrodes are placed. Your electrodes are placed.
Arm and legs, sir.
Limbs, yeah, limbs.
Okay, sir.
Either arm or leg, it's called as limbs. So it is called as limb bleeds. Bipolar limbs or limb bleeds. This is unipolar or augmented. Okay, so this is lead 1, 2, and 3. So usually called as AVF, AVL, and AVR. Okay, what is AVL, AVF, AVR?
AVF is attached to left foot, sir. Augmented voltage foot, sir.
Okay, AVF. Okay, AVF is augmented. V for what?
Voltage, sir. Augmented voltage foot.
Yeah. Any other answers?
Augmented right arm.
Augmented
Voltage right arm. Augmented
instead of
vector.
voltage, I will be expecting different answers. Some books they have voltage.
Vector.
Vector, augmented vector foot. Okay. Different books refer different answers. So, like Webster refers augmented virtual foot, augmented virtual left arm, augmented virtual right arm. In some book refers augmented voltage foot, augmented voltage left arm, augmented voltage right arm. Okay, and there was some small expression for finding augmented leads. So, can anyone Goldsman? Sorry, this is who invented augmented leads? Not Goldsman. Who invented augmented leads? It's Wilson, right? So this is Wilson. This is invented by Einthoven. This is Wilson, and chest is invented by Goldsman. Okay. So according to Wilson, he have given some expression. AVF is nothing but 3/2 left leg minus VW. Okay, and AVL is 3/2 left arm minus VW, and AVR is, you may have some numericals here. It's nice to learn. Right arm minus VW. Okay, VW. What is VW? Wilson's center terminal. This formula to find VW is nothing but 1/3 right arm plus left arm plus left leg. So this is VW. Okay, so all those formulas is collectively given here. You can have some quick view on this, and it's nice to learn all this. Okay, so clinical studies, yes, few clinical studies are like arrhythmia, myocardial ischemia, infraction, pericarditis, chamber hypertrophy, entropy, electrode disturbances, hyperclamia, hypoclamia, drug toxicity. So ventricular fibrillation, atrial fibrillation, tachycardia, bradycardia. So there are n number of clinical studies, pathological studies can made by using ECG. Okay, the doctors, while the perspective, if you take ECG and give it to doctors, their own perspective is different. Okay, நம்ம வந்து ஒரு PQRS இது மாதிரி பார்க்குறோம். அவங்க வந்து ஒவ்வொரு பீக்கும் வந்து it will tells you lot of information to them. They'll gain lot of information from each signal, each time period. T wave time period, QRS time period. இந்த ஒவ்வொரு செக்மெண்ட்டுக்கும் it matters a lot. They'll identify lot of arrhythmic conditions. Heart related diagnosis can be done. Lot of diagnosis can be done by using a simple ECG. With 350 rupees ECG signal, you can estimate lot of abnormalities. Clinical trials can be made. With this, I'll complete ECG. And any doubts before we wind up ECG? Another 10 minutes I'll wind up remaining topics. It's very simple. Anonymity எவ்வளோ டீட்டெயில்டா இருக்கோ அவ்வளோ டீட்டெயிலும் நடத்த முடியாது. Just gate there may be simple questions. At least you should know what is what. Okay. What is EOG? It is electrocardiogram. It is recording electrical potential of what? Electrical potential of
I.
Cross I. Okay, so it is non-zero. The signal is non-zero when there was movement, I movement. I is not moving, it is zero. Okay, if you move the I left, right, so obviously that you will receive some signals. During left, this is right, this is left, this is right, this is left. During blinking, you will have different biopotential data. Okay, what is electroretinogram? So one application, how eye is responding to light. QERG. Measured for cornea. especially corneal. Okay, so this is how the signal looks. So this is amplitude, time. We have A, it was denoted by A, B, C, D, and all. So when lights on, you'll have a maximum peak. When lights off, it will slowly diminish and it will go. Okay. The electrical potential. So EMG, the muscle potential, like you can have a response of muscle signal, electrical activity of muscle signal. You can find lot of nerve disorders, muscle disorders. For a sports person, hernia, like if there was some injury, muscle injury happens, right? So hamstring injury, and when they give some tens which in area muscle treatments are given. So in rehabilitation, they'll make the patients to they try to come back to original state. So all those things happens in EMG. You can analyze how your muscle respond. Okay, நான் இப்போ வந்து ஒரு மசிலுக்கு வந்து ஒரு அல்ட்ராசோனிக் டயத்தர்மில ஐ கிவ் தெரப்பி, ஹீட் தெரப்பி ஃபார் அ மசில் விச் இஸ் நாட் கண்ட்ராக்டிங். ரிலாக்ஸ் சாரி கண்ட்ராக்ட் ஆகுது, ரிலாக்ஸ் ஆக மாட்டேங்குது. ஸோ அப்போ தசை பிடிப்புன்னு சொல்லுவோம், ஹாம்ஸ்ட்ரிங் இன்ஜுரி. when it happens, they slowly they'll give ultrasonic diathermy and they'll make the muscle to relax. அது அப்படியே பிடிச்சிக்கும், கண்ட்ராக்ட் ஆகி ரிலாக்ஸ் ஆகாம போயிடும். அப்போ when you give diathermy, it will slowly starts to relax. Okay, by using EMG, you can analyze how your cell is responding. If I am giving some stimulus, if your cell is not responding, it may be a permanent damage. So for paralysis people, the permanent damage will permanent damage will happen. For some sports person, slowly it will react and it will come back to original state. Okay, so this is how the EMG signals are recording. And in EMG, there may be one numerical question they may ask you, like about conduction velocity, CV, conduction velocity. They'll have 2 points, so S1 and S2. We have S1 and S2. So these 2 points, they'll have some electrodes and they'll record EMG, and the signal which is acquiring between 2 points will be taken into care, and they'll have one formula to calculate conduction velocity. Okay, so this is S1 signal, this is S2 signal. Okay, you have some formula. Conduction velocity I'll write here. Distance D by L1 minus L2. Okay, so this is the distance. So this is D, and this is L1 amplitude signal. This is L2 amplitude. So for S1 it is L1, S2 L2. So by finding the difference between these two, you can find conduction velocity. There was one question here. So conduction velocity U equal to D by L. So here, what will be the true value of nerve conduction velocity if distance between two nerve points is 0.m? So D is 0.3 meters, and time difference between stimulation of first and second electrode is 6 milliseconds. Okay, so your L1 minus L2 they have given is 6 milliseconds, so 10 to the power of minus 3. Just substitute here and find answer. 0.3 by 6 into 10 to the power of minus 3. It will gives you, I have 50 meters per second. Very simple. And in some case, they'll give L1 and they'll give L2. You have just subtract it and find answer. They'll give some milliseconds for L1 and milliseconds for L2. Just subtract it and find it. Only one NAT questions from ECG, EMG, EOG, ERG, all those parts. You just remember what is what. So most probably it is very lightly they'll ask questions from these parts. And EEG, it is electroencephalogram. And very quick review on what are the waveforms available in EEG. There are 5 waveforms, right? What are they?
Alpha, beta, gamma.
Okay. First waveform edu varum? It is delta, which we should start with delta. And we have theta, delta theta, and then alpha beta. Gamma. There may be question from occurrence of each waveform, and it's nice to learn what will be the frequency of each waveform. Very lowest frequency கூட கேட்பாங்க. ஒரு 4 waveform which is the lowest frequency of EEG signal. So always delta waveform is the lowest frequency. It have 0.5 to 3 hertz. Very low. And theta, it have 4 to 7 hertz. Alpha, we have 7 to 15 hertz. And beta, we have 15 to 30 hertz. In gamma, we have greater than 30 hertz. Obviously, it is 22. Correcta soluna 22 to 30 hertz. And this is very high. And occurrence, when delta wave occurs, theta, alpha, beta, gamma occurs. For information, quick review I'll give you. Just if you want, you can take a micro notes. Delta waveform, it occurs during sleep. It is a slow waveform. It occurs in babies. Okay, it occurs in babies during sleep time. Infants. Okay, during sleep time you have delta waveform. So your neurons, your brain waveforms will not activate. So it is not in active state when you go for a deeper sleep. So that's why you have a lower frequency. Yeah, delta wave lower it have, when you sleep, you don't get when your neurons are not getting transmitted and it's in inactive mode. Okay, so theta, it increases in young people's, young children's, and you can identify drowsiness. During drowsiness, ஒரு மாதிரி தூக்கம் வர மாதிரி இருக்கும் போதெல்லாம் you will have theta wave in adults. Alpha, during relaxation and closing of eyes. Okay, beta, active thinking, when you are doing calculations. Okay, there you can have beta waveform. And very anxious, very high alert. Okay, during the padatamana situation, when your brain is thinking more, so there you can get beta waves between 15 to 30. Okay, so this is where the beta waves and occurrence. And application of EEG, again, as like ECG, we can find epilepsy, sleep monitoring, apnea, even mentally retarded patients, they can identify by using EEG waveforms. All those analysis can be done by using EEG waveform. And it's where you keep electrodes. What is a standard EEG system you have?
10-20.
Okay, 10-20 system. What is 10 and what is 20? It depends on electrode or something else. It depends on distance. 10% of your frontal, 20% of your occipital. So where you place electrodes, 10-20% you should leave some gap. So based on that, they have 10-20 electrode system for EEG, right? And where you keep ground, EEG, where you keep ground, which region you can keep ground? Earlobe, right? So backside of ear. So here you keep ground electrode. You can ground the electrode at back of ear. Okay. So there are other things there, like block diagrams and all. It's not needed for gate. For anagnostic, you should go through all those things, right? So that's it about electrical biosignals. About biosignals of, most probably we have covered all the biosignals in blanks and ECG we have discussed in detail. Okay, so with this we'll wind up today's class. Any doubts, clarifications?